This is Sg2 Perspectives, a weekly conversation between the Sg2 intelligence team and industry thought leaders about the biggest trends in healthcare. We're happy you joined us today. Enjoy the episode.
A lot of the trends that we have been talking about will continue to drive growth in the inpatient space, just certainly not at the pace that has been for the last several years. What we are expecting to change is not necessarily that top line growth number, but what and who are the patients in your inpatient space is going to change.
Welcome to Sg2 Perspectives. I'm your host, Jayme Zage. I am joined by two colleagues, Tori, Richie, who you recognize as one of my co-hosts on Sg2 Perspectives, and Karyl, Kopaskie. We are seeing some interesting trends in volumes, softening and flattening of trends, in some cases declines. Tori and Karyl are the best equipped to talk about what we're seeing, all the data that we track, as well as some of the clients that we talk to about volumes and strategies. Karyl, Tori, thank you for joining me today to have this conversation.
Happy to be here.
Let's start by letting everybody know, what is that trend that we're seeing? What are we hearing from our clients? And what is the data telling us?
Just grounding ourselves in what's happened over the last 5 or 6 years. Coming out of the COVID-19 pandemic, we experienced robust return of volume. So year-over-year growth in inpatient discharges. It wasn't abnormal for health systems to see 5, 6, 7, 8% year-over-year growth for the couple of years coming out of the COVID-19 pandemic. What we've started to see between 2025 and 2024 is a stabilization in that year-over-year growth. If we look at Vizient's clinical database across all ages, discharge growth between the first 3 quarters of 2025 versus the first 3 quarters of 2024 was about 2%. If we compare discharge growth with those same 3 quarters in 2024 versus 2023, the discharge growth was 5%. So we've seen a substantial flattening in terms of the growth in discharges that health systems are experiencing.
And key point there too, just to put my pediatrics hat on for a second here, is that this trend really is happening across adult and pediatrics. For pediatrics, we have been talking about some of these declines in concordance with birth rate decline, but it isn't just that. We are starting to see that return even in children's hospitals where we have maybe anticipated flat to increasing growth despite some of those birth rate trends. We're even seeing that in the children's hospital setting on the pediatric side as well.
And if we unpack why is this happening, our hypothesis is it took us a bit longer than we initially expected to work through the COVID backlog. And when I say the COVID backlog, I mean the services that were disrupted directly because of the shutdown, also everything that came after the COVID-19 pandemic as it relates to workforce shortages, supply challenges, difficulty getting patients to a point of discharge and coordinating with post-acute facilities. We have seen alleviation and improvement in operations across health systems over the last couple of years that has allowed health systems to optimize care delivery, which allowed that tail in terms of post-COVID recovery to persist for a couple years longer than we were initially expecting. That's what took us through 2024. But now that things have begun to stabilize, we're trying to encourage health systems, don't go into your planning exercises expecting to put up those year-over-year growth numbers that you've gotten accustomed to. We need to be thinking about a much more normalization of those growth projections.
And something else to keep in mind, at the same time, we have overcome some of those big operational rocks that Tori was just describing. We also are doing that alongside of growth and innovation as well. We have and are starting to see in the data impacts of GLP-1, PCSK9 inhibitors. We do have effects of some of these medical innovations. We are starting to feel that on the inpatient side, definitely for segments of the inpatient population. We are also seeing a resurgence and commitment to some of the gene therapies and increasing access to biosimilars and some of the other infusion-based care as well. If we think about the shift in operational efficiency, overcoming some of those big challenges that we had in the immediate aftermath of COVID, alongside that ramping back up of clinical innovation and increasingly leveraging medical intervention to help prevent some of those inpatient admissions, we have both of those trends moving at the same time. And we are starting to now see that bend in the growth in the short term immediately after COVID.
The inpatient admissions, we're really focused on the inpatient is what has been flattening. The other trend is the outpatient shift is accelerating a little bit, also coming out of COVID.
Absolutely. Another couple of external factors to consider is we've started to see this downshift because the drivers that we've talked about, this return to normalcy, this acceleration of innovation, but there's also downward pressures on demand right now, driven in large part to payer dynamics, contraction in coverage and access is upending the way that individuals are interacting with health systems, meaning we're seeing the disruption to care pathways because people may not have access to insurance in the same way that they have before. Rising cost of healthcare as well and other economic drivers are making folks more price sensitive than ever before, which can also then lead to the deferral of services. We have this confluence of factors that are coming together and dampening demand, not only today, but we think that those trends will persist over the coming few years.
Some of those pressures will also help to facilitate that shift to outpatient. We have people either more strategically scheduling, when is the right time for me to have a procedure, maybe delaying that, maybe trying to find a lower cost setting for that. We do think price competition will be a big factor over the next several years, and that will also help to facilitate some of those shifts in care, not only inpatient to outpatient status, but also shifts in site across the market as well.
The other component of this is we've also seen some contracting of the population. We're not seeing population growth in a lot of our urban areas right now. That might be another component that is having an impact as well, especially over the last year.
Oh, absolutely. And highly encourage folks listening to do scenario modeling as it relates to their local market dynamics to figure out if you do see contraction to population within your market, what does that mean in terms of expected utilization? And how does that then factor into your various planning efforts?
Definitely true. On the market side, we are going to be looking for that specific market nuance. Are we going to see those shifts and those contractions in specific markets and not in others? Again, putting on that pediatrics hat, we are still watching birth rate decline, but we are seeing that soften in some markets. While we are continuing to watch a global effect on population contraction across the US, there may also be pockets where we're starting to see a flattening of that birth rate decline. The devil is always in the details when it comes to this. So Tori's plug for scenario modeling, that's really going to be the key to trying to tease apart what are those different pressures that we're facing. We're seeing contraction, we may be seeing changes to birth rate, and what effect is that going to have on our payer mix in the market? What effect is that going to have on our service demand in the market? And how can we meet that patient demand where it is?
You've both talked about the renewed efficiencies, but specifically, is length of stay still where it was? What's the trends around length of stay and post-acute transitions? Anything there that is also having an impact on this volume?
Average length of stay is down, which is so interesting and such a testament to the efforts that health systems have gone to in terms of improving that operational efficiency and improving coordination across care settings. What we've seen in the last 2 years, this has become a major area of focus for health systems. Health systems that I'm talking to, they are increasingly transparent and embedding metrics such as medically ready for discharge or estimated date of discharge in their EHR. And that's something then that their care teams are incentivized to meet. And then getting patients beyond just medically ready for discharge, but to actual discharge requires an improved coordination in terms of getting those post-acute partnerships strengthened, expanding capabilities in the post-acute and home setting, ensuring that there are educational resources available for caregivers or family members who might ensure that their loved one is being well taken care of when they get them home. There's been just so much investment in that space over the last couple of years.
As we've seen some of those operational returns to efficiency on the workforce side, we're also seeing doubling down on some of those classic operational and quality improvement measures. One that stands out is we continue to see declines in length of stay for sepsis. We know sepsis is a huge component of that inpatient utilization, especially with new AI tools and new efforts to even more rapidly diagnose sepsis and monitor patients for sepsis and ensuring that patients with sepsis that have the appropriate care models to support them. We are continuing to see length of stay decline for that particular segment of the inpatient space. And we know that's a big volume. And so even small shifts in length of stay decline there will have a big effect on days.
If we think about what's coming down the pike, we do expect average length of stay to rise over time. If for absolutely no other reason, there continues to be pressure on getting low length of stay patients out of the inpatient care setting. And so even if that means that the patient is treated exactly the same as they are today, it could be as simple as just a status shift when it comes to billing. But we expect there to be continued pressure from the payer side to be able to flip those patients from inpatient to outpatient. We're seeing that pressure accelerate with the elimination of the inpatient only list. There are 285 codes that are coming off of the inpatient only list this year. The reality is, as you start shifting those lower length of stay patients, what's left behind is higher length of stay. And so thus you're going to see average length of stay increase.
As we've seen more of that outpatient shift, especially in those surgical procedures, those are patients who might have used skilled nursing facilities that now opens up a little bit more capacity in the skilled nursing. That also helps us to move patients out a little faster. Again, all these changing dynamics here. You've alluded to moving forward with the length of stay, Tori, you guys leading the forecast. It's not done yet, but can you give us a little teaser of where the forecast is going? How is this volume trend playing out in the first 3 to 5 years of our forecast?
We're still expecting modest growth in inpatient discharges over the coming 3 or so years of the forecast. I can't say that the trends that we're seeing play out as it relates to inpatient utilization are all that surprising to us. We've been surprised that we stayed in this period of robust year-over-year growth for as long as we did. It was unrealistic to us to expect that to persist long term. We're staying true to the course that we had already set within the forecast, but are just continuing to account for how do we adjust as it relates to innovation, as it relates to those payer pressures, as it relates to coverage contraction, and what does that mean for those specific care groups or procedures that are affected.
That's right, Tori. Some of the big trends that we've been talking about that are going to be driving long-term growth haven't changed. We are still experiencing an aging of the population. We are continuing to shift more and more care to the outpatient space. What is in the hospital is becoming more complex. Our survivorship gains are fantastic. The improvement and innovation in clinical technology is opening up more possibilities for more treatment for different patients. And a lot of that treatment does at least require some inpatient utilization as well as outpatient utilization. A lot of the trends that we have been talking about will continue to drive growth in the inpatient space, just not at the pace that has been for the last several years. An important thing for folks to remember is that what we are expecting to change is not necessarily that top line growth number, but what and who are the patients in your inpatient space is going to change. That's where really digging into how is my payer mix going to evolve? How is my inpatient population going to change? How are the needs of those populations going to change? And what does that mean for my staffing considerations? What does that mean for my bed mix? Do I have enough med-surg beds versus critical care beds? Do I have enough observation spaces? Do I have enough outpatient surgical spaces? Do I have the right mix of types of beds and types of places where those patients need to be to meet the demand where it's going to go? While that overall top line number may not be changing too much between version 25 and version 26 of the impact of change forecast, what is underneath the hood there is going to be driving different demand and different needs. And that's where we think the strategic impetus lies, is how are we going to adjust what we have today, prepare for the infrastructure and the staff that we need in the future to meet that need.
I love that, Karyl. I'm reminded of a phrase that you've been using during forecast QA, a complicated zero. Even in instances where we might expect demand for a particular service to stay essentially flat over the course of the decade, exactly what you just described is embedded within that very complicated flat forecast. It's the change in who that patient is, how complex they are, the resources that are required, what that means from a financial and workforce planning. It's a totally different ballgame, and you're not going to be able to approach that patient the same way in 2036 as you are in 2026.
Putting that mindset on of what's changing, what advice do you give to organizations? You've already talked about scenario planning. Any other advice, if they're not hitting the numbers they were expecting, what can they do to double down to help make sure they're ready for what's coming?
This is advice that is so annoying to hear, but the importance of staying nimble, this concept of, do you have the right services? Do you have the right beds? Do you have the right physical space for patients? And are you able to flex that space as those change and that demand fluctuates across a given calendar year is just so important. And think about the role that you want to play. Think about the mitigation strategies that you want to deploy in order to protect and safeguard your payer mix, the resources that you're able to provide within your community in order to help ensure that you're bridging access gaps as folks are faced with tough decisions on how it is that they engage with the system.
I agree with all of that, Tori, and would only add, as we shift from demand to utilization, how do we convert that demand into growth? A big piece of that is engagement. It's access, but it's also trust, making sure that patients have confidence that we aren't just delivering isolated services, that we are delivering a healthcare experience so that we can be engaged with them across that entirety of their healthcare pathway, as opposed to focusing on surgical, or to borrow a phrase from consumer packaged goods, like a widget growth. As hospitals, we're very focused on how do we grow an incremental service. And that is not necessarily the perspective that is going to be necessary to drive growth in the type of environment that we're seeing here. We need to be thinking more about patient engagement. We need to be thinking more about relationship building and quantifying the effects of that longitudinal relationship with a patient, capitalizing on growth in that way, meeting the patient where they are along their journey to ensure that we are able to sustainably grow over the longer term.
I like that, Karyl. It resonates with me in terms of thinking about the value that we deliver to our consumers has to take on a different level. It's not just about the value of the encounter. It's the value of the overall care experience. That's a great place to end our episode today. Thank you, Tori and Karyl, for coming and just chatting with me about the volume trends. Appreciate it. Always love having you both on an episode. And thank you to our Sg2 Perspective listeners for joining us today.
Thanks for listening to this episode of Sg2 Perspectives. Please don't hesitate to reach out to Sg2 if you have questions or suggestions for future episodes.